Hi, I'm Katy Moncivais. I have a doctorate degree in biomedical engineering, and I've worked in the regenerative medicine and medical device industries for over a decade now. I'd like to welcome you to this video series, Regenerative Medicine Moments, in which I answer the most common questions about the realities of regenerative medicine in the United States today. There are lots of ways to look at the differences between regenerative medicine therapies, so we'll start with the simplest way first. The easiest way to understand the differences between regenerative medicine therapies is by looking at their source. Do they come from the patient being treated, or do they come from somewhere else? Therapies that come from the patient being treated are called autologous. These are the most frequently used regenerative medicine procedures right now, and they have the longest, best track record in the medical literature. Therapies that come from a person other than the patient are called allogenic or allogeneic. Because these therapies come from a different person, they must go through stringent processing and testing to ensure they are safe. Some products like this may claim to contain live cells or even live stem cells. Independent testing has shown this claim to be misleading at best. What's really interesting is it doesn't really matter if these products have live cells in them. Well, your immune system is designed to recognize and attack foreign material. That's why organ transplant recipients have to take immune-suppressing drugs. They have to prevent their immune system from doing its job. But in people like you or me who aren't taking immune-suppressing drugs, if someone else's cells are put into our body, they will be recognized as foreign by our immune system and they will be attacked and killed. So even if allogenic products do have live cells in them, at best, those cells are going to cause inflammation and irritation before surrendering to death at the hands of your immune system. In my opinion, that's probably one of the reasons we see so few publications with allogenic products. They just can't get past the immune system, so they never have a chance to work. Yes, there are different types of autologous therapies. This facility offers platelet-rich plasma, or PRP, and bone marrow concentrate therapies. Platelet-rich plasma uses the patient's own blood to form a fluid full of cells and materials that encourage healing. The cells are part of the patient's immune system, and the healing materials are platelets and proteins that are part of the normal healing process. Platelet-rich plasma is kind of like fertilizer in a garden. It provides materials that speed up the growth process. This facility offers bone marrow concentrate as well. This technology uses a patient's own bone marrow to form a fluid full of cells and healing materials. Sounds familiar, right? Well, bone marrow concentrate is a bit like PRP, but with some key differences in the form of adult stem cells. Bone marrow concentrate contains mesenchymal stem cells, hematopoietic stem cells, and endothelial progenitor cells. The most important of these three are the mesenchymal stem cells, or MSCs. MSCs are the body's natural resource for repairing and rebuilding cartilage, bone, and every type of connective tissue. Bone marrow concentrate has been successfully used in orthopedic procedures for over 30 years now, and it has the longest track record of safety and efficacy of any regenerative therapy in the medical literature. PRP comes in second in that category. There is a grain of truth to that idea, but it's 90% misconception. It is true that the number of mesenchymal stem cells in our bone marrow declines over time, but it's a slow decline. In fact, one of the world's leading orthopedists and researchers in regenerative medicine routinely treats patients over the age of 70 years with their own bone marrow concentrate. And he finds that these procedures are generally better tolerated than total joint replacement, with less side effects, shorter hospital stays, and faster recovery. Another thing to keep in mind about mesenchymal stem cells is that they're prepped by their environment. Bone marrow-derived mesenchymal stem cells are poised and ready to repair bone and cartilage. Adipose-derived mesenchymal stem cells are poised and ready to become fat cells. That's right. Fat is a form of connective tissue, and it is one of the forms of tissue that mesenchymal stem cells can become. Adipose-derived mesenchymal stem cells can repair other types of tissue than fat, like cartilage or bone, but they require additional signals and time in order to do what bone marrow-derived mesenchymal stem cells would do automatically. The last thing to know about fat-derived mesenchymal stem cells is that they require extensive processing. And sometimes that processing includes an enzyme whose job is to chew up connective tissue. So if these cells aren't extensively and thoroughly washed before they go back into a joint, they may bring with them a substance that actually damages joint tissue and speeds up the degenerative process. The icing on top of that cake is that one prominent researcher has shown that adding adipose-derived mesenchymal stem cells to the treatment of osteoarthritic knees doesn't add any benefit. So you have all of the extra processing, all of the extra risk with these cells, and no benefit. I just don't see any good reason to use these cells. But I do see reasons to avoid fat-derived MSCs, at least when it comes to orthopedic conditions. A lot of people have heard misinformation about regenerative therapies, especially when it comes to stem cells. There seems to be this very common misconception that embryonic stem cells are better than adult stem cells, but that's not really true. Yes, theoretically, embryonic stem cells can become any type of cell in the human body. But let's think about that for a moment. Where and when do embryonic stem cells know how to behave and how to become every type of cell in the human body? Only in the context of a pregnancy in a uterus. Outside of that environment, embryonic stem cells just don't have the signals and cues they need to do anything like what we would want them to do. And medical literature has shown us repeatedly that when we try to take them outside of that environment and put them into the adult human body, they do far more harm than good. Compare that to mesenchymal stem cells, whose natural home is in the adult human body, whose natural job is to repair cartilage, bone, and connective tissue in the adult human body. Mesenchymal stem cells know what to do in your body. That's why we have more than 30 years of published medical literature showing them to be safe and effective in orthopedic applications. So embryonic stem cells may be something that scientists research in a lab, but they don't provide any benefits for patients in the here and now. In my opinion, the best regenerative therapy is the least invasive option that provides the benefits the patient needs. In many cases, that's PRP. In many other cases, that is bone marrow concentrate. In almost every case I've ever seen in this field, the best choice, as determined by a licensed, trained physician, has been an autologous regenerative therapy.